Good morning.
Now you're live.
Good morning, Hannah.
Good morning.
So,
Wait, I'm really happy this is not sweet. I was worried it was going to be sweet.
Really?
It's
So
not
that I took care of actually. That's the only part that they heard.
Oh, it's so funny.
Do you want me to be scanned and you can like watch?
No, it's okay.
Yeah?
Yeah.
Okay.
well, so you go first to 1/3. You go 2/3.
Okay. So I just feel like I was
Yeah.
scan hiding.
That's okay.
So hold on a second.
Woo.
What was the best way?
We'll
So
do.
this is the I brought this all the paper towel. I prepared everything for my princess. So today we're gonna continue upper limb. Last week we did more anterior part of the arm and forearm. Today we will focus on posterior part. But should we scan one more time? Last week one?
Yeah,
Just
like a
making
quick
sure.
overview. Yeah.
So when for us to show you better screen, we are doing this one in the room. Come on in. Three regular member came. So we're gonna just review last week one. So arm period, someone else is coming. So the left of the screen is gonna be proximal, and then right screen is gonna be distal. Good morning. How are you? We need more gel. Make yourself comfortable. Take off your I don't say take off your shirt. That's what happened to me in the past. I talked to one guy who is visiting me. I said, "Why don't you take off your shirt?" And he started to sweat more. I said, "Why you're sweating?" That's the Dr. Kim's life, you know. English works for me. Okay, so you guys can see. So left side of the screen is going to be more proximal part. Right side of the screen is more distal part. So when you look at it here, somebody want to use color flow? Okay, so now Vera is showing interesting field in the box. You guys can see vessels, right? The pumping one, blue one is the axillary artery. Red one, several red ones are axillary vein. Can you remove that one now? Remove the color flow. And then here, when you think about the brachial plexus, median nerve is superficial, right? When they come out from the cord, median nerve is superficial. That's why you guys can see how this median nerve is hiding at this point. But actually, can you point to this one here with the cursor? So median nerve is very superficial. This one.
To the left. Yep.
Yeah.
That, yeah.
Yep. And then maybe to show better, maybe we can make it a little bigger.
Mm-hmm.
And then change maybe that's better. Gain a little bit. So yep, that's the median nerve. So that's very superficial. But ulnar nerve is a slightly posterior part here. You can see Heakyung. That's ulnar nerve, right? Ulnar nerve. And then radial nerve is underneath of the axillary artery. That's why you guys cannot see. But this is going to be radial nerve area. So it's going to be later moving. So now you see median, ulnar. So we usually say median nerve is 12 o'clock. Ulnar nerve about 3 o'clock. And then radial nerve is about 5 o'clock. So you guys can see through the axillary artery. And then this white line, remember there was conjoint muscle with the teres major and latissimus dorsi, which is inserting to the greater tubercle area, not the tubercle.
Medial lip.
The tubercle, right?
The bicipital
How do you say? Bicipital groove, but the medial side.
Medial
So
leaf
three
of
muscles,
the
three muscles are anchoring inserting over there, right? So it's going to be teres major and latissimus dorsi, and then triceps is going to be there, right? This is you guys can see muscular cutaneous nerve. Where's the muscular cutaneous nerve? Vera, before you get fired. Okay, the white nerve in the middle is the It's moving, right? Muscular cutaneous nerve, widest nerve in the body. And then that facial line follows. Above is biceps shorehead. Lower is coracobrachialis. So if I move, actually, I don't know, I can show with this scrub. So from coracobrachialis, 3 muscles are,
From coracoid?
yeah, no, the coracoid process.
Yeah.
So if I go coracoid process, can I find it here? It's coracoid process.
Yep. It's very uncomfortable.
Yeah.
Yep.
It's uncomfortable. Coracoid process, if I go medially, which is the left side, that's the biceps shorehead. Medial is the pectoralis minor, right? And as I come to the lateral side, it's gonna be biceps shorehead. So let's see if I can do, biceps shorehead, see? Here. And then this is gonna be coracobrachialis, right? So can you show it to people? So you have to just follow the coracoid process, and then medial to the coracoid process is the teres pectoralis minor, and then next one is coracobrachialis as you come to the lateral side, and the last one is the short head of the biceps. Okay, so and then let's go through very briefly so you guys can scan. So here, we look at the muscular cutaneous nerve, scan fast. So now we see coracobrachialis. Coracobrachialis just disappeared, and then brachialis is popping out, right?
Yeah.
So do you think you can show the cursor? Your cursor?
But the nerve I lost.
Lost you don't. Oh, nerve. When I scan fast, that's along the fascia line. That's the see. I'm going up. Muscular cutaneous nerve. See here? Between the biceps and brachialis. Biceps and brachialis. So you can put the needle around there, and the elbow flexion is going to happen if this motor nerve, muscular cutaneous nerve, motor branch to the brachialis. If you are using the nerve stimulator, then arm is going to be flexed, and the forearm is going to be pronated slightly. But if the nerve is to the biceps, then supination of the forearm, elbow flexion. Okay, so now we are moving. So you can see brachialis is really popping out now, right? This 2D. Now this is the starting point. Look at the arm. My transducer is in the middle of the arm. At that time, you can see slight brachialis. Not brachialis is very small here, right? This is the only brachialis. Fascial line. You can see fascial line. Yeah. And then as I come down, brachialis is getting bigger. And then, actually, if I go to the radial side, do you see the radial nerve we learned last week? Yeah. The radial nerve is in between brachialis and brachioradialis. Yeah. So that part was I want to give you guys a test before we end. Okay, so here, look at my transducer where it stays. It stays about 1/5 from the elbow joint, not from the shoulder. 1/5 from the elbow joint. When you get here, if you move your transducer to radial side, you can see the white radial nerve. Radial nerve here coming to the anterior part. It was in the posterior part, right? Radial nerve was in the posterior part. But by the time you come this 1/5, it's in the front part, anterior part. So when the radial nerve comes through the anterior part, it passed the luteum fascia. It passed the the front. Luteum. I was right. It passed the luteum fascia to come to the front part of the arm. So radial nerve. We're gonna go over the radial nerve today. So now since we are reviewing last week, so we reviewed here. So I'm gonna move my transducer continuously, and the biceps is disappearing, almost gone. That means we are in the elbow joint. But you remember the home base? We have to have distal part of the humerus. So to see the trochlear and capitulum. Capitulum is in the radial side, trochlear in the ulnar side, right? So I'm gonna move down a little more to have our home base. See, you look at it, you see nice cortical bone and cartilage, right? So here, this is our home base, which means we are at the elbow joint. At the elbow joint, so you can see this is the left side of the screen is my radial side. Right side of the screen, I'm moving my transducer to the right side. That's my medial side. Actually, if Heidi is a baby in one screen, we can see radial nerve, medial nerve in one screen, right? Because elbow joint. Maybe I'm gonna act like a baby because I'm a little smaller. So let me put my probe here. See, you guys can see both. Can you hold on a second? Can you freeze? Oh, not yet. Freeze. Okay, so here, cluster. So this is my brachioradialis. This is my pronator. And then this in the middle, Heakyung. I'm old, that's why the muscle looks old. Oh my goodness. But the white tissue, the hyperechoic is the whole brachialis, this triangle one, right? This is all brachialis. But this darker one is the Pronator Teres. But look at this brachial artery here. Brachial artery next to Heakyung. Just imagine this is the kind of a honeycomb shape. So this is the medial nerve. So at the elbow joint, on your medial side, you can see medial nerve. If you come to the radial side, you can see radial nerve here. So already two nerves are in one screen here at the elbow joint. We didn't put the name, so we cannot save. Okay, so that's all right. Amy, I have the best mother, Amy, in the whole world. So if we need it, we can do this one, which I did on. Okay. So any questions? You deal with it. We cannot answer to you. So let's do that again. So now home base is here. So last week we practiced anterior forearm. What did I say last week? Your interesting muscles are all flexors, right? So this is my elbow, and then biceps tendon in the middle of the elbow joint, and then palmaris longus is in the middle of the wrist joint. You draw the line between two tendon or two muscles, and then forget about the radial side. Just pay attention to the ulnar side. That is all your flexor muscles are sitting here. So I'm going to move my probe. My transducer is in the middle, right? I'm going to do like this. And then I divided her forearm. So I'm going to move with my probe to the medial side. So you can see one popping out. That muscle is the Pronator Teres. But you remember Pronator Teres start from the, I'm moving up to elbow joint. Where's the trochlear? A little bit. Ooh, I know. Oh, here. Above the trochlear, the very nice black one. That is the Pronator Teres starting point, right? And as I come down, right below the elbow joint, already Pronator Teres is very big. That's the pronator. You remember we are in the medial side of the forearm, okay? So first big muscle is the Pronator Teres. Okay, thank you. And then if hide this muscle, maybe we have to study hide this muscle. Looks like my muscle arrangement, because the nose muscle, which is the FCR, is on the top of Pronator Teres. Mostly it's next to each other. Let me see Vera's. Maybe Asian muscle and maybe different. See, look at this is mine. See, my Pronator Teres is underneath, and on the top is a nose muscle, which is FCR. Look at this. Vera looks like Asian, but let's see.
But I'm not.
You are not. So
Russia's part of it.
yeah, Russia is. But look at this.
Oh,
Her
next to
pronator
it.
teres and nose muscle is next to each other, right? And then your turn. Maybe Amy's forearm must be different too. You have gel. Yeah. Interesting, right?
Yeah.
I thought I'm a strange person, but or a special
Quite a
person.
strange term.
A special
Yeah,
person.
wild child.
So this is Amy's. Amy's pronator teres is I'm gonna put in the middle, but look at her nose muscles next to each other, right? Can you cursor? Yeah, that's the FCR. The
That's
round
FCR.
oval shape is the pronator teres. So Amy's and Vera's is next to each other, but Heidi's and mine is on the top of, right? So remember, everybody's anatomy is different, right? Prettier people's pronator teres and FCR is on the top of each other. So look at us, how pretty we are. But Amy and Vera, I'm not so sure they're pretty. They are next to each other. They're jealous of each other. You know what I mean? So remember, that's why I think the shape is very pattern of the muscle is very important, right? We call the FCR is nose muscles. So remember, now my probe is in the middle, and then I'm moving to medial side. This is above the elbow joint, right? Trochlear. Over there, I'm moving down. Pronator teres is getting bigger. But as I move my probe to medial side, the nose muscle is on the top of the pronator teres. But look here, another important, what did I say? Underneath of the pronator teres, we can find the median nerve. Where's the median nerve? I'm scan fast, scan slowly. The honeycomb shape, I see it in the...
Oh, maybe this one. This one.
Yeah, that's the one,
Oh, I wasn't
right?
there.
So from here, you have to pay attention, right? Remember, underneath of the median nerve, now you're going to start to see anterior interosseous nerve, right? Because I'm going to scan fast down, you see? Here,
Yeah, it's diving. Yep.
diving
Yep.
into the anterior interosseous membrane, right? You remember, I'm going to scan, I'm proximally moving, I'm distally moving, see? Scan fast, scan slowly, and it's going to, we already missed the, this is the anterior interosseous, this is a nerve. I think we showed a great pictures last week. Here, median nerve, I'm moving, interosseous nerve is diving down to interosseous membrane. Here, see, here.
This one.
Yeah, this one. It's moving, see?
This one.
Yep, moving down, moving up. Do you see them moving?
The small one?
Yeah,
That's one
here,
coming
here.
down.
This one.
From here. See, I'm not on.
From the median.
I
So
see it
from the-
diving, and then I
And
stop
then I see
seeing
it.
it.
Yeah, that's why, because it's deeper muscle.
Yeah.
The nerve is moving away from your probe.
Right.
That's why you have to practice, right? Because when very first time we didn't know what that was. Now we know how it moves. So, but how do you know about median nerve? Median nerve, we always say, oh, in between FDS, FTP, right? But before they become between FDS, FTP, is underneath of the pronator when we start. Along the pronator, underneath of the pronator, when it comes to underneath of the pronator, you pay attention. At that time, it gives anterior interosseous nerve.
And
So
then-
that's why it's hard to see it because it's diving into the deeper part. The nerve is moving away from your probe. That's why it's hard. Let's try one more time. So I'm gonna come down from the pronator teres. So here, okay. Median nerve, do you see? Good. Now Vera is getting better. Median nerve. I'm moving down, scan down. See, now at this point, it start to give the branches.
Yep.
It's very hazy.
Yep.
It's coming
Here.
down. See here, hazy. Good. The
But then-
arrow part. So it goes to the anterior interosseous nerve, the membrane. Okay. So look at this. We are in the about between 1/3 to 1/4 of the forearm. But when it comes after that, this median nerve actually here in the middle, if you look at the middle, median nerve pops out. That's the main median nerve, not anterior interosseous nerve. Now you can say between the FDS, FDP. So when you say, oh, median nerve is in between FDS FTP, is in your mid forearm. Now you can understand how median nerve moves, right? So now, what did I say? When you come to the in the middle of the forearm, what do we have to do here? You see two nerves together again, just like we saw two nerves at the elbow joint. But here, now we see two nerves in the mid forearm. Can you freeze? So here, this is the mid forearm. You guys saw it? This time, what do I have to do? You have to be famous, right? So the famous pianist came to you that you have finger dystonia, third finger dystonia. This is the place you're going to do each individual finger muscles. Remember? This is the median nerve, right? This is the median nerve. This is the ulnar nerve. You draw the line, which is the fascia line. And then still you can see FCR here. Third finger, second finger, fourth finger, fifth finger. This is FCU. Because FCU always comes with teardrop, which is ulnar nerve, right? So you can see each individual FDS muscles. But if you go downstairs, FTP sitting here. Above the ulna, from this whole muscle, go around is FTP. FTP is in order. 2, 3, 4, 5. Wrap around, but above the radius is the first flexor pollicis longus. So 1, 2, 3, 4, 5. This is the area you're going to do each individual finger muscles. Okay? Mid forearm. Then unfreeze. Then now median nerve, ulnar nerve, you saw it. But this one tips here. When Heidi has no palmaris longus, right?
No.
So you remember, we said Pronator Teres here, and then the nose muscle pops out. And if I go medially, next to FCR, we should have a palmaris longus, but she doesn't have it. When you see the palmaris longus, what do we have to look for it? Sunglasses, right? Central tendon, good. But Princess has no palmaris longus. So now the beautiful Dr. Kim's forearm is coming out. So, a little more. If you don't know, let us know because we are going over now. Here, so now once again, we are beautiful people. So my FCR is sitting on the top of the pronator teres, nose muscle. Now look at next to the nose muscle, there's another muscle is popping out. I'm moving my probe to medially, right? And then there's round muscle, and I'm gonna show. Look at the central tendon, and then do you see sunglasses? Actually, guys, buy me sunglasses. I don't have sunglasses though. See, look at my probe where I am. 1/4 from the elbow joint to the wrist. 1/4 distal from the elbow joint, and then you can see round, almost mirror shape, right? With the palmaris longus and FCU. How do I know FCU? Because FCU has teardrop. The hazy one on a nerve. In the middle is tendon, which I call the nose.
Yes.
Yeah, that's nose, right? Can you freeze? So here actually, this part is the palmaris longus. This is my fat on the top. This is my FCU and teardrop, which is the ulnar nerve. This part of the finger is what finger is this? Very superficial. Fourth finger. You remember 3 start first.
3, 2,
So 3 is here. 3, 2, 4. This is the 4. Oh, I'm sorry, guys. This is the fourth finger, okay? So when you're in the proximal part, FDS, the very superficial one is fourth finger. So if you drop the medication here, fourth finger may get relaxed, but rest of muscle may not get relaxed. So what do I say? When you do the finger muscle injection, like a spastic quadriplegic CP, you guys want to do injection, go to the mid forearm and drop the medication like a 1, 2, 3, 4. If you want to give it 20 units, drop, 4 places, 4 separate places. So it covers the whole fingers. Okay. So Okay. Then you learned where is a so her now you're very clear. There's no palmaris longus. So she may have like we can see maybe 3 and 4th finger here, right? Can you move your finger? 3rd and the 4th. Amy is good with the moving finger, but anyway, so that's good. Let's do in the middle. Now Heidi is gonna move 2nd finger FDS. Oh, that's hard. The 3rd finger. The FDP is actually I'm holding FDP. I'm sorry, guys. FDP, and then there's 4th finger. 4th is this one, honey.
I know.
4th.
I'm trying.
I know. 5th, move 5th. 5th. See, in order, right?
Yeah.
Let's try FDP. We're gonna do FDP. FPL first. On the top of the radius, FPL. See, that's the radius. On the top of the radius is FPL. And then 2nd finger, 2nd FDP. Oh, good. Heidi is getting better. 3rd finger, 3rd. See, do you see the anterior interosseous nerve over there? Yeah, that's the anterior. The white line. It's moving, right? That's the anterior interosseous nerve. Makes sense? It's deeper muscle. And then we are getting better too. 4th finger FDP, then 5th FDP. It wrap around the ulna. So it's very big FDP. And then now practice the FDS.
Oh my goodness.
Oh my goodness, FDS. Second is in the middle, right? Let's do 3rd. 3rd is 1st. Can you see? 3rd is
here.
yeah. This is FDS. Show FDS first. This is FDS triangle one first. Can you draw? Yeah, that's the FDS. Oh, I'm sorry. FCR. This is the FCR. Can you fix me? Correct
No, I
me.
was confused.
FCR, and then fascia line here, right? And then this is all FDS. So now Princess is gonna move. 2nd finger, 2nd FDS. Start from the middle, isn't it weird? And 3rd comes to the front. And 4th and 5th. FD, 5th is here, good. Yeah. Or Amy, you wanna move her finger?
2.
Maybe.
2 was harder.
Here. 2nd, we are moving 2nd. See, 2nd is not in the front, right, guys? And then 3rd more front, right? 3rd, 2nd, and 4th. See now 4th and 5th is 5th. Clear.
Very clear.
Yeah, very clear. Okay. So now we all learned. And then let's come down continuously. I know. We have a fly. We didn't. Fly wants to learn ultrasound. So you can join us.
That's why.
And then we are moving continuously downstairs and until we see the pronator quadratus popping out. Now, do you see it? All of a sudden, in between FDS, FTP, pronator quadratus popping out, right? And then you can see median nerve on the top of that. And then when you measure the carpal tunnel syndrome, this is the area you're gonna measure on the honeycomb, the dark one.
The whole honeycomb right now.
See this one?
Yeah. This one?
Here.
A little bit
Ooh,
right there. Oh, this
yeah,
one.
that's the, look at that, that's median nerve. And then as I scan down, you see pronator teres. Now median nerve, you still follow median nerve. You measure here first, and then I'm gonna continuously go down. It's on the top, almost on the top of pronator quadratus, and then you go down to below the carpal tunnel. You still see median nerve over there. See, dark one underneath of the era. You can freeze here. So this is the median nerve. This is the median nerve, okay? So that's the way you can measure the difference above the pronator quadratus, below the pronator quadratus.
Can you show us again?
Draw, you wanna trace?
Yeah.
Yeah.
Here to down.
Oh, trace, scan down, okay.
And then I think we should move on to the posterior arm. It is 7:30.
We're gonna, then Vera is gonna be the princess.
Yeah.
Okay, so we're gonna scan down one more time. This is the we are in between FDS, you see two nerve here, right? And I'm going to scan down, look at the median nerve I'm going to bring to the median nerve in the middle. As I scan down, you see pronator quadratus popping out, popping out, popping out. Now median nerve is almost on the top of the pronator quadratus, right? I'm going to toggle. Do you see that? And then I'm going to continuously scan down. Now we're going to do carpal tunnel on the top. This is the on the top, underneath of the carpal tunnel, the round one. That's the median nerve. That's median nerve.
This one?
Mm-hmm.
This one or this one?
Top.
The dark one.
That one.
Yeah.
Yeah.
See, I'm going to scan up. See, that's median nerve.
yeah.
Ta-da! Okay?
Yeah.
All right. So now we're going to change the model. Give her some massage. Or massage ticket. Instead of a Starbucks ticket.
Okay.
All right.
Alright. Posterior.
I should have been the one who should scan by. This is your workshop. Right?
I'm gonna show
You know
you
that?
Oh,
big muscles.
Oh, she wants to go over. Vera is going to
big
pay me. She's asking me many things, which I may not have the answer. I should not laugh too much when I watch my own video. I laugh too hard. Amy was a very calm one.
I know.
Yeah, you can hear Amy.
Right.
Yeah.
Barely we hear Amy.
My face is everywhere, and my name is on the screen usually.
And your last name is Test by now. See, when you wear the fancy scrub, very hard to get there. It's not good.
Oh, yeah.
I don't know. I don't want to ruin your
No,
fancy.
don't worry, I guess.
We should come up with some different scrub.
With the top, or shoulders,
Yeah.
top is better. Like
So
tank top.
today maybe we review a little bit of radial nerve together with the posterior part of the forearm. So once again, I'm gonna start with the axillar because that area is the old starting point, right? So once again, look at this. We are axillary artery over there, and I see her median nerve. I'm gonna scan down. Median nerve is moving. That's the median nerve where the arrow is. Arrow, that's median nerve. Here, the radial nerve is when we scan. Do you see radial nerve moving now? So maybe you wanna scan and then I. So it's like here. When I.
It's hard to move this fast.
Let me move. Oh, that's the radial nerve area. I have to see this way.
Yeah.
It's hard to.
It's way easier to see.
Oh, here.
So here.
Yeah, that's the radial nerve is coming, right? So radial nerve now moving to the posterior part. Actually, this is the lateral. You look at this, almost I'm in the lateral part. And can you move your scan over there? The arrow. That's the radial nerve moving here. Oh, perfect. Now radial nerve is this one, right? Radial nerve was underneath of the axillary artery moving there. When we go to the posterior part, it passed triangular interval. If you look at her shoulder from you turn around a little bit. So I'm gonna move my cursor from the axillary artery to this area. And then look at this. This is the shoulder. Shoulder teres major sits here. Humerus sits here, like this. Teres major, humerus. But then here, triceps long head. There's triangle. The radial nerve from that axillary artery comes to the triangular interval over there, and then come to the spiral groove. So spiral groove is going to be in between the medial triceps and lateral triceps. Before, what was it? When they pass the triangular interval, radial nerve is in the lateral, the long head of the triceps, and medial triceps. Then it goes to spiral groove in between
Medial and
medial and lateral, right? So here, takes could be like very long if we want to study very hard. Yeah. Right? So here, let's see how we can show the one moving part. Here, axillary artery. So you can see teres major here, right? Can you move your teres major? We are and triceps, and then we are scan down. It's hard, but we gonna come down. We go in the posterior part. So let's. If you here, can you see the radial nerve already? Yeah. So we're in the triceps. If I go middle here in the bone, on the bone, already we are in the spiral groove. Look at her probe. We are here in almost between the proximal 1/3, middle 1/3. Now spiral groove start from here. How do we know? Because the radial nerve is on the bone. That's where you can see my radial nerve is moving. Scan fast. When you try to see the nerve, you have to scan fast, right? Nerve is moving. So that is the in between the medial and then lateral head of the triceps, and then I'm gonna scan down continuously, and it's gonna be moving. So from the anterior, lateral, posterior, and medial. Here's how do you say, wrap around and then moving to the anterior part, but when it wrap around, the radial nerve is going to be in between biceps and triceps. So let's take a look. So here, we are in the spiral groove with beautiful radial nerve. Can you believe that? 2 branches. I think 1 branch because in the spiral groove, it's going to give 1 branch to the lateral side of the triceps and 2 sensory nerve coming out from there. So 1 could be, there are kind of 3, dot, right? So 2 are sensory branch, 1 is the motor branch. And it's going to come down. Now I'm going to move my probe to the medial side. See, look at this. Radial nerve keep moving. So you guys doing good with the cursor. So here, still radial nerve. Here is kind of this. I flipped over. So let's say left side of the screen is gonna be posterior part. Right side of the screen is gonna be anterior part. So from the posterior to the anterior, I'm moving. See here, it's gonna be biceps. This is the biceps, this is triceps. Okay? Now, after you pass that part, now where we are, look at this. We learned this one already, right? Just the distal 1/4 or approximate 1/4 from the elbow joint, you start to see the radial nerve here in between brachialis and brachioradialis. So you got it? So look at, where's my probe? Her arm is here. I'm not still in the elbow joint. I am just 1/5 or not 1/4, about 1/5 or less than 1/4. Or if you move your probe, we can see the radial nerve in between brachioradialis and brachialis. As you come down, here, and then you come down, radial nerve continuously. Now you can see elbow joint. By the time you come to elbow joint, you can see nice capitulum, right? Capitulum. And then I'm going to go downstairs. And then here we have, what do we have to know? Radial nerve. When you come here, you see the trackable nerve. Dun. One, looks like 1 or 2 or 3, right? Radial nerve. That nerve here, you guys are always asking me the deeper branch is superficial branch, right? The deeper branches start going through the supinator via arcade of
Crush.
crush. So, I don't know. I can find the arcade of crush, but let's try to find out.
Oh, we found it.
Oh, she is gonna
Yeah.
find it.
We once found it before, so we should be able to.
Let's try to find it. If we cannot find it, that's your fault. It's not my fault.
Maybe I don't even have it, you know.
Better, right? So here again, through that arcade of crush is going. The radial nerve is moving to posterior part. So radial nerve is very busy, up and down, going back and forth, right? Here, so elbow joint, our home base here, right? Now I'm moving posteriorly, supine, and then distally. Supinator is gonna pop
Yep.
out here. Here, this is the supinator, but I think varus muscle is smaller. This is the do you see in between? Let's freeze here. So, yeah, this is the FCR, FDS, right? And then this is the radial nerve going through the supinator to be deeper branch, right? Deep branch. So we have to find that the arcade of crush is gonna be around the FCR area, but
I think it's when it dives into the supinator, no?
yeah, it dives, but the entrance is the arcade of crush,
Exactly.
and then the exit. After exit,
Uh-huh.
it goes continuously in between the superficial muscle, deeper muscle.
Right.
So, and then from the radial styloid process, about 9 centimeter proximal, the superficial branch is popping out to the skin area. So, unfreeze. So, I don't know if we can find the arcade of crush. Around here.
Yes.
Must be, yeah, that one.
That's
Yeah,
what
that
we
one, the
recall.
arrow area. That must be the arcade of crochet. If I scan down, see, now it's coming in.
Mhm.
Do you guys see it? 2 branches?
Yeah.
Wow, we found it. So that's the arcade of crochet. And then as I come down, and then look at my probe. I'm moving distally, but also moving posteriorly. I'm moving posteriorly. Look at the radial nerve in the supinator, and then it's gonna exit. Right? Exit here. It's coming out, right? Once it comes out, look at my probe is in the proximal 1/3. Proximal 1/3 usually supinator ends.
Hannah asked FCR or extensors. I don't know. We're
Did I
delayed.
Extensor, right?
We are doing extensors.
Brachioradialis
Yeah,
and then extensor radialis.
What did I say?
Maybe you said
Maybe
FCR.
you
I think you said FCR.
I apologize. Nobody fixed me. It's the extensor. We are moving the extensors. Let's do it again.
For arcade. FCR or extensors. She said for arcade.
For arcade, it's going to be extensors. Underneath there was the ECR, right? Oh, yeah. That's why we need the questions, because I can say something wrong things. And
Thanks,
then-
Hannah.
Thanks, Hannah. Hannah is which Hannah? Hannah is easy. Princess. Carpet. And they still, you can have this drawing, okay? Heidi can compare what, if I make mistakes, say it. Because I can continuously. I drew this one last night.
Yeah. Multiple.
Okay. Okay. So, Hannah, we're gonna do it again. This is the radial nerve in between the brachialis and brachioradialis. As I move distally and posteriorly, this radial nerve is gonna go into here. This point is the arcade of crush, but can you freeze here? Freeze. Look at this. This is a ECR, right? This is the ECR supinator. It's coming in. So it's not FCR. I apologize. This is ECR, okay, guys? So this is beautiful, right? Okay. model of the ear. Okay, so we're gonna go downstairs continuously now. Supinator deep branch is exiting. See now, look at, what did I say? This is still ECRL. You can see the shape. What did I say last week? EDC is always square shape. So if I move continuously posteriorly, look at this square shape. Now you guys can see EDC. Let's review the muscle before radial nerve, then you can understand better, right?
Yeah.
So home base, okay? I'm moving radially. So here you can see three muscles. First, can you show the brachioradialis on the top? That one, brachioradialis. Underneath, ECRL. Underneath, that's the ECRB.
Oh.
No, ECRL, that's the one.
They all look like one.
No, two, that's two. Three, you can see three. Here, see? Facial line, you can see. Can you freeze?
Yeah.
Freeze. Okay. Yeah, this one, thank you. This one is brachioradialis, right? This one is ECRL, this is ECRB. This is EDC's starting point. Okay? So three muscles are here. Uh-huh. And then this is still like kind of lateral area. It's not really posterior area.
Mm-hmm.
As I move my probe posteriorly and distally, you start to see this little stuff is the EDC become square shape. Okay? Let's take a look.
The little stuff.
Hmm?
The little stuff.
Yeah, little stuff. Let's take a look at the little stuff. Home base one more time. Oh my God, we're gonna be staying home forever. Okay, we're gonna move the little piece.
Yep.
Little piece. Follow the little piece as I move laterally and distally, popping out, and the more distally become square shape. EDC. But still, underneath the EDC, we can see radial nerve inside of the supinator. And then I'm gonna go more laterally, but slightly distally. You can see little muscle popping out. EDM, or digit 20. This large one is ECU. So small one. No. Next to that one. Yeah. In between. Here's that. Now you can see clearly square. Stop here. Stop. Freeze. So, So this is EDC, right? Now EDC is not square anymore since we passed. And then this one is the EDM, or digiti minimi, or digiti quinti. Then this is very small. This, I can actually, is this the shape? Measure. Maybe I'm wrong. Showing.
It's not that small. It's the one I'm working on all the time.
Really?
Yeah.
This is the EDM.
That's so hard to tell.
Okay, this is the EDM. Like the male who does weight-lift, like what's it, Jordan. When we had Jordan, his muscle very clearly. We have to go to gym before we come to the workshop. So that's the EDM. Next to this, oops, I'm gonna cancel. How can? Oh, clear. You know, this one, measure. Oh, it's gone. So, cursor. The next to this EDM is gonna be ECU. ECU is actually large. So then you can see within the supinator, radial nerve is still to be deep branches going through. So when it exceeding, radial nerve is gonna be in between superficial nerve muscle, deeper muscle. Superficial muscle is what? EDM, ECU, EDC is superficial muscle. Downstairs is what we learned. After supinator only almost proximal 1/3 and disappears. After then, another three muscle popping out, right? What three muscle? Abductor pollicis longus, EPL, EPB. They are the deeper muscles downstairs. So it's in between superficial and deeper muscle, radial nerve is running. And then it's going to be posterior interossseous nerve. Okay, move.
It's a lot of anatomy.
Yeah, it is.
I know. I'm not going to have a dementia.
Nope.
No, I cannot. Okay. So
This is good.
so now you guys know the square muscle popping out. So ECRL is beautiful. She has a extensor longus. I'm gonna move. Brevis actually brevis longus, right? Move like this square, and then still supinator is there. I'm gonna follow the exceeding radial nerve. It's all gone. The supinator is disappeared. The new muscle came out. Do you see it? Let's pay attention to supinator. Supinator, 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 supinator. Disappearing. See, disappearing. And the new muscles are popping out.
Yeah.
So last time we struggled when we started this live streaming. We had a hard time. FPL, flexor pollicis longus, origin is ulna and radius. So it covers, initially it covers everything. Then later, EPL comes from the radial side, ulna side. So by the time you come in the middle, two muscles, you see? This is the EPL. This is the APL. So
And abductor.
which is the extension? This one? That's what I'm confused. This one is the extension.
It looks like abductor is in the middle. Look,
No, it's on the top of the radius.
but it's not moving.
Oh, so right. Still the supinator was sitting there. This is the APL.
Okay.
Push it. It's gonna be EPL. I cannot see action.
This E, F, A, B.
I can see extensor.
So do extension.
So
See, that's the EPL.
yeah,
On the top of radius,
uh-huh.
EPL.
and then
EPB didn't come out yet. EPB comes later. EPB comes later. So EPL, APL. Now do APL. Show the APL action. Heidi. So you have to do this
so
way.
when I
Yeah,
do
push this way.
I do the
I
thing
do
is,
the-
when I do it, I don't see it. When I do a little bit like this, I see it moving. When I
Yeah,
do,
that's APL.
when I do like true abduction,
This is EPL. So EPL is gonna be on the here two muscles, right? That's EPL, the arrow area, which is radial side, and then APL is in the ulnar side. I'm sorry. I apologize. Opposite. So guys, cancel out everything. And the EPL is in the ulnar side. APL is in the radial side. Okay. So I always saying wrong things when I come here. So I am going to cancel out this. Here supinator is still there. That's supinator.
okay.
Now APL is popped out. APL. Then if you go to ulnar side, the little one popping out EPL. See, now it's very clear. And then supinator is totally gone. Got it, guys? So previously my direction was wrong. I apologize. This part is the superficial, can you freeze? Yeah. So this is the superficial nerve right here, superficial muscles, nerve muscles. And then this between the radius, ulna, this is the deeper muscles. So you have to look for the radial nerve in between here because supinator is gone. Okay? And then here, posterior interossei nerve is coming out, going to the posterior interossei membrane. I think it's here because blood vessel here. It looks like this area is coming. So let's review again. Amy confirmed, right?
Yeah.
Yeah.
I'm trying to get the layers better.
Amy is gonna show a better layer. I don't know how we can show, but here. So let's go to supinator to follow the radial nerve. Supinator. Let it exit out. Exit. By the time it exit out, EPL came out. Oh, I see it over there.
So we said EPL is coming off the ulna, correct? That is what we said.
Yeah,
Extensor.
EPL.
So
And
first
APL is
APL
radius, and then.
looks both,
But you have to read the origin because it looks
Right.
like
right.
the APL is both. EPL is only ulna.
Origin
Double
of
check.
APL. Origin of APL, middle 1/3 of the posterior surface of the radius and ulna, the
See?
interosseous membrane for
Mhm.
APL.
So remember, APL is from both. So we're gonna double
EPL
check.
is ulna.
EPL is only ulna. Okay? We're gonna double check. Columbia resident, never gonna forget about that. Dr. Kim will forget, but you guys not gonna forget. Okay, so look at this. Let's start from the home base one more time. Home base, radial nerve. We are moving to the posterior part. So ECRL, ECLB over there. And then this is very proximal, right? The EDC is very small, so I'm gonna move distally. Then you see supinator, but you lost to arcade of Froschie, so I'm gonna move back, and then I'm gonna look for it from here. This is the arcade of Froschie, and then as I move distally and posteriorly, you can see the radial nerve inside of the supinator. You have to look for the exit. Exiting out from the supinator. Now look at this. Now deeper muscle coming. Supinator almost gone. It's going away now, right? So now we are seeing only APL, which is start from the radius and ulna and the interosseous membrane. And as I go distally, now EPL has to pop out. Where's my, oh, here. EPL popping out, rest of them are all APL. And then as we go down, EPB has to pop out. I don't know. EPB is from radius only.
Posterior surface of the disc.
But it's so hard for me to see the fascia line here. I cannot see fascia line. See? Only 2 muscles still. It should be. So you guys are all clear now, right?
Yeah.
It's very clear now. Because we usually skip the posterior part of the forearm all the time. So my neck. Okay.
You want me to move?
no,
I can
no.
actually
Okay.
move this one.
I hope that they can see my. Oh, good. So look at this. Now supinator. Now deeper muscle. So now in between, that's the radial nerve. In between superficial muscle, can you change the height, the depth over so the people can see better?
The other way.
The other way, more. Good. So now look at this. In between this here supinator, the radial nerve exiting as I move distally, and this nerve is gonna be in between that little dot. That's oh good. That's the radial nerve. Look at that. Radial nerve, and then it's gonna be posterior interossei nerve as I go down. Did you see? Yeah.
Yep.
It's very hard to see because just like anterior interossei nerve is moving away from the probe, go to deeper area.
I feel like
Here,
does.
that one,
Uh-huh,
that one,
uh-huh,
yeah,
uh-huh.
that one.
Yeah.
So by the time,
Right?
Clear.
Look at this, I'm like,
yeah. So you guys say, oh, Dr. Kim, I don't see it. You figured it out because it's very hard to see it, but we saw it, right? And now another one, it's not a good teacher. Oh my God, deal with it. I don't know what to say. Yeah. But the funny thing is that this motor branch ends in the fourth compartment of the extensor area. Don't ask me too much, okay? It ends in the fourth compartment. Sensory, let's take a look sensory branch if we can find it. In between what? EC, brachioradialis and ECRL. The superficial nerve coming from continuously going down, but it more comes to the real superficial area is in the about 9 centimeter from the radial styloid process. Let's go here. Where is my brachio? Let's see, brachioradialis. We never followed brachioradialis, right? So brachioradialis. Oh, it's hard. It's 8 o'clock. Oh, we have to go. Looks like that one. Because it's gonna go to the skin. This one. the little one around the bone area.
Yeah.
Oh, yeah, go a little more to the right side of the screen. Yeah, that one. See, it's moving to the fat. Oh, that one. It's moving. Oh, yeah, that one. It's going to the skin area, subcutaneous area. So we apologize, but we reviewed part of radial nerve and posterior muscle. Actually, this was really good because now we are very clear with the posterior compartment of the forearm muscles. Whew. I tried to upload the nerve part, the PowerPoint, sometimes. But everybody, thank you so much. We're gonna finish here. Have a wonderful day. Bye bye.
Bye.